Good morning, everyone. My name is Stephen Lott, and I am the Senior Lead of Communications for the McMaster Health Forum. It's my pleasure to welcome you to today's COVIDEND webinar, Scanning the Horizon for COVID-19-related Priorities, Insights from COVIDEND's Global Horizon Scanning Panel. This webinar will introduce participants to COVIDEND's Global Horizon Scanning Panel and share the priority topics identified by the panel from its most recent meeting on October 28th. COVIDEND's Horizon Scanning Lead, Heather Bullock, will also discuss the inputs created to aid panel discussions and the process the team uses to produce them, as well as how insights are shared back with panel members and the research synthesis community. Before I begin, I wanted to note that there will be an opportunity for questions and answers later, so please use the chat box to ask your questions or share comments during the presentation. Also, if you have any feedback after today's event, please email us at covid-end@mcmaster.ca. But now, please welcome Heather.
Thank you so much, Steve. So as Steve mentioned, I'm Heather Bullock, and I am leading the Horizon scanning process for COVIDEND. And I'm excited to share what we've been doing and what we've been learning with you today. So let's get started. Just for those of you who aren't familiar with COVIDEND, it is a time-limited network that the evidence synthesis and guideline community has convened in response to the COVID-19 pandemic. And here is, the goal is to help support decision-making about COVID-19 for decision makers to find and use the best available scientific evidence, and also for researchers to avoid waste by reducing the duplication in and better supporting the coordination of evidence synthesis. As we all know, COVID-19 is new, so evidence and therefore evidence syntheses are relying on a relatively small evidence base compared to topics that have been around for years. And so there's an opportunity here to do some coordination so that we are being as efficient as possible. There are 50-plus partners in COVIDEND, and as I mentioned, they mainly stem from the evidence synthesis, technology assessment, and guideline groups, with some groups who are more focused on that intermediary capacity relating to government and tailoring things to policy makers and system leaders. The group spans the full spectrum of pandemic responses from public health measures, clinical management, health system arrangements, and economic and social responses. And it is truly a global community. There are both high-income and low-income country groups represented, and here's just some of the logos of some of the partners that they've shared with us. So how does Horizon Scanning fit into this? Well, I thought I'd start with just a little overview on what Horizon Scanning is. It's a structured process that focuses on identifying and assessing and prioritizing innovations and emerging issues that might significantly influence current policies, service delivery, and or practice. So it's a way of looking forward to the horizon to see what might be coming down the pike. It involves systematic scans, and it's useful in providing a view of what might be important in the future and help us organize around that a little bit more so we're not caught off guard or on the back foot when it comes to having responses that would be helpful for decision making. Specifically for COVIDEND, the Horizon scanning process includes a global panel, which is comprised of diverse, strategic, and out-of-the-box thinkers and doers. And their goal is to proactively identify long-term, recurrent, and emergent issues that need to be prioritized, and therefore we really should be doing some evidence synthesis work related to it. They're diverse in their coverage across the parts of the taxonomy, so those are the 4 areas where folks need to make decisions related to COVID-19 that I mentioned a slide or 2 ago. And the 4 key target audiences. So these target audiences are citizens, so these could be service users, patients, and others in society, providers, service providers and others, policymakers, and researchers. They're also diverse in terms of WHO region and primary language coverage. So it's not just a bunch of English-speaking Western folks we've done our best to try and make sure it's as global as we can make it. The main focus is to identify priorities for living syntheses on recurring priorities. So this is, some of these topics are going to come up throughout the whole pandemic. For example, the evolution of knowledge about mask use, the evolution of knowledge related to vaccines. And so we think that there's value in having the evidence synthesis community focus on some of those priorities that are likely to be needed over time and needed to be updated over time as new evidence comes online. Here's a little bit more detail about the panel membership. So there's 36 panel members that meet monthly. As I mentioned, there's 4 types of participants, and we have a fairly good WHO regional spread, with the exception of Southeast Asia. It hasn't been because we haven't reached out, it's just that people have not had the ability to prioritize this. Everybody, as we know, is really busy and focused on trying to do their best to support the responses related to the pandemic, and often other jobs on top of that. So I just wanted to give you a sense of who we've got involved and where they come from. The global groups are more like decision-making bodies that span WHO regions, such as the WHO or OECD, those types of organizations. So what do we do? Well, the first thing we do is we have a team of folks, myself, and on that intro slide, you would have seen there were 4 other team members. We do a scan for what is called in Horizon scanning lingo hits. So we look through the internet, it sounds very 90s, but or maybe early 2000s, but we search government ministries and agency websites, non-governmental organizations, international organizations, companies and online journals, and we also monitor social media and news media. What we're looking for is shifts in the conversation related to COVID-19, things that seem to be emerging as issues, but not things that have been discussed for weeks or months on end. So how we're trying to understand how the conversation is shifting related to COVID-19 globally, and in particular parts of the world. Using those hits, we develop a 2-part briefing note. So the briefing note includes those issues we've identified as hits that become potential issues for consideration from the scan. And the second part of that briefing note is a sort of running list of potential top priorities for living evidence syntheses and where they're currently lacking. And part of what we do here is we link to any existing best evidence syntheses that exist on the topic using another initiative from COVIDEND, which is the COVIDEND inventory of best evidence syntheses. So before the panel meets, they get a briefing note with these 2 pieces of information, things that we found from the scan, and secondly, just from past meetings with them, this list of ongoing priorities and what is the evidence synthesis looking like related to those priorities. Next, the panel meets, and we structure the deliberation. It's a 1-hour meeting. We structure it around 2 deliberations. The first is about new, emergent, or recurrent issues. So that first part of the brief, they review what our team has put together. They add to it with priorities that they don't see there, but they feel that's where conversation is emerging, or if there's a big need. The second part of the deliberation is about the prioritization of the issues that are already identified. So we give them this list of issues that they've identified in past meetings, and they have an opportunity to say, yes, this is still really important. We definitely need to focus on that in a continued fashion. Or, yes, this is an important issue, but I think we're missing this particular take on it, which has become really important over time. And I'll give you some examples of this in a couple of slides. And then we have started instituting a survey where panel members during the meeting, get to rank the priorities and issues of importance to them. So there might be 5 or more issues related to public health measures, and they can use a process of sort of rearranging the topics in order from their most important priority to their least important priority. So it gives us a sense of whether there's consensus on what are some of these key priority topics that we desperately need to focus on. So once that meeting is complete, our team then summarizes what we heard, and we create a document that's a summary of insights, and it includes this revised list of recurrent, emergent, and long-term issues. And then we share it with the panel. We also share it with the COVIDEND partners in their weekly meetings, and we post it to the website so that others have access to them. So you can currently see, you won't see the October one. This will be new. It's not quite complete and up there yet, but you will see earlier months. So I'm going to shift now to tell you what's on the list of priority topics for living evidence syntheses related to COVID-19. And these are structured by area of our taxonomy of decisions that decision makers need to focus on. So the first area is public health measures. And you can see here there's 4 topics that have been consistently identified as key by the global panel. So the first is supporting adherence to public health measures. And that includes communicating the rationale and the trade-offs. And in addition, thinking through the politicization of the different contexts and the politicization of particular issues. So the panel in this session really identified and emphasized that a lot of these public health measures have, become hot political issues in different countries. And that's really changed the nature of the discussion. That has been one that has been kind of more of a health specialist focus, public health focus, to one that's in more of the public discourse, and policymakers and politicians are getting involved in the discussion. And it's really shifted the ability to think through and use these measures, and how we have to address supporting adherence to them. Second is strategies for testing and for test, track, trace approaches that optimize the use of existing capacity. As many countries in the Western world in particular entering a second wave, there have been many criticisms of the ability of countries to do the work that would give people the information they need to make the best decisions possible related to ensuring their own health and the health of others. Third is outbreak contributors, and that's really trying to think about drawing as much as possible from a diverse array of research fields and understanding how these outbreaks are happening, how the COVID-19 is spreading globally, and drawing as much as possible on different fields so that we have as a holistic understanding as we can. Fourth is surveillance, analytic, and synthesis capacity in public health units and linkages to other parts of the health system. So that's a capacity-related concern. On the clinical management side, the panel has emphasized the need for more evidence synthesis work related to long COVID and or long-term sequelae of severe COVID. So really trying to understand what are the longer-term implications to this illness. Second is screening for and managing emergent mental health and substance use issues. This has been on a global radar for some time, and there are a number of planned and existing evidence syntheses, but the panel is still seeing this as a real priority because the mental health and substance use issues are still very much emergent, and different countries expect that these needs will become even higher in terms of a priority for their countries over time. Third is the concurrent management of COVID-19 with other seasonal infections. And, here we would be thinking of, and they have been discussing, influenza. And fourth is emergence of endemic diseases in urban environments, and really thinking through kind of what the urban environment is contributing to the disease and the evolution of the pandemic. In terms of health system arrangements, there has been a lot of discussion over time, and a key priority is currently around vaccines. And you'll see here a list of different aspects of vaccines that the panel has identified as being key: vaccine trust, and actually more recently, vaccine passports is something that the panel was interested in understanding more about. Second, the approaches to strategic purchasing of supplies and equipment. So that is PPE, but also other supplies needed for the response, and balancing accountabilities both within countries and across countries related to purchasing, so that we don't end up with have and have not countries when it comes to being able to leverage opportunities to respond to COVID-19 effectively. Third is the responsive and agile restoration of non-COVID services where possible. So this has been something that's emerged from the fact that many services have had reduced capacity and or waves of reduced capacity over time, and how can we do a better job of capitalizing on slack that we might have within health systems to restore some of these services. And relatedly, efforts to address health human resource shortages and motivation and well-being in the response. Fourth is consolidating and optimizing the value achieved through shifts in virtual care. So virtual care, obviously there was some abrupt shifts to it in the early days of the pandemic. What have we learned, and how can we optimize the value moving forward, and what needs to be delivered non-virtually, and what is as good or better being delivered virtually, and pros and cons. And then finally, packages of responses. So the panel has really been talking about the complexity of this issue and the need to think through multiple components simultaneously as decision makers. And so this priority is speaking to that, as well as the need to consider centralized or decentralized approaches to responses from the health system and also from the government more generally. Next is economic and social responses, and this is one category in the taxonomy, but it's a wide range of issues that each have whole fields dedicated to them. So what we've done here is we've highlighted kind of the subfields in red, and then what the panel has focused on. So in terms of economic and social responses, they prioritize culture and gender. So that specifically, they've been talking about the additional risks related to gender-based and domestic violence. From education perspective, they have had a lot of discussion and have encouraged prioritization of a better understanding of the impacts of harms related to school closures and reopenings, and as well as pedagogical innovations that could support ongoing education. So what can we learn from this that we could parlay into the future of education, making it better for all? Third is financial protection and enhancing financial security by adjusting the safety nets and retraining the workforce if necessary. Fourth is food safety and security, specifically here supply chain issues and food poverty. Climate action, this is about the additional risks of the environmental crisis. So thinking about the synergies between the COVID-19 response and climate action, and how could we leverage the response to ensure that the environmental crisis is being addressed. Next is transportation, and here, particularly in some regions of the world that are really dependent on tourism and travel, the understanding better what the risks are to particular approaches to tourism and travel, for example, quarantining or screening at airports, and that's when those vaccine passports again might be important. But trying to understand how the differential responses that different countries have created compare with one another in terms of the risk of spread and the benefits or lack of benefits to the economy due to tourism. And then finally, citizenship. So this is linking community participation in the pandemic response with outcomes and capturing innovations in participatory approaches. So how can we do better around engagement of citizens and leveraging in some areas of the world? We heard through this panel that there has been a fairly good job of leveraging the community participation for an effective response. And then finally, the panel has identified a number of things that don't fit in any one of those 4 categories, but are key, that they think are key for teams that are addressing and creating evidence syntheses and addressing these priorities. And so these are key considerations overall. They're asking that teams that are doing evidence synthesis work or other related activities that they consider explicitly committing to foregrounding equity considerations, examining the benefits and harms of citizen experiences and costs, and acknowledging variation in state capacity, because that can really hamper the ability of countries to respond and how to optimize that. To consider interdisciplinary teams where possible alongside methodological experts to get that fulsome picture. And finally, to consider committing to explicit cycles or triggering for updating living evidence syntheses. So on these hot topics that are key priorities, the evidence base is shifting so quickly, there is a need to be addressing what new primary literature has emerged and thinking through what explicit cycles or triggers might be for that. Finally, just to give you a sense of some of the kind of very specific things that came out of the October meeting that aren't yet in that list of priorities exactly, although some of them can be subsumed under some of the categories, but just give you a flavor of what it's like more to be there. Here's some of the things that the panel identified in October. So they discussed virus dispersion and the impacts of the widening geographic distribution of the virus. And that, obviously, we've been interested in virus transmission. But this is a specific take on it that's talking about, there was, in certainly the first wave, often a very concentrated the virus is concentrated in particular geographic locations, and as time has moved on, it seems to be dispersed more widely across geographic areas, so not just concentrated in particular cities or regions within a country, but as more widespread, and what are the impacts of that? And then secondly, the concept of COVID fatigue and its impacts on adherence. From a clinical management perspective, there was a discussion about understanding COVID-19 as a endemic that's co-occurring with a range of other non-communicable diseases, and that is creating inequities in terms of the impacts on populations within countries that might be affected, are more likely to be affected by those other non-communicable diseases, and as well as COVID-19. So layering on impacts collectively, and just trying to unpack that a bit more. From a health system arrangement perspective, as I was mentioning, there was a discussion about the potential value of vaccine passports, and also a discussion about the governance arrangements of health systems. So this is trying to understand how the organization, whether it be strong or weak of the health system, corruption, centralization or decentralization, and primary care and the strength of it is impacting COVID-19 responses, so that we can get as many lessons learned as possible from this pandemic. On the economic and social response side, they had identified balancing the finite public funds with the different immediate, medium, and long-term COVID-19 demands, and incomes and social protection. So how are we going to take these meager public funds, thinking about the different types of responses related to COVID-19, put them over a timeline of immediate, medium, and long term, and then thinking through what this means from an income and social protection perspective for citizens. Secondly, new approaches to public funding that support fairness and equity, and this was particularly emphasized for women and other vulnerable populations. Impacts on labor market entrance during the pandemic. Some of the panelists discussed how early career scientists have been impacted significantly by shifts in available funding, but there was also a more general discussion about how this is true in many other areas of the employment market as well. And then finally, direct comparisons of policies that have been variably applied. So as I was mentioning before, length of travel quarantine periods, and is 10 days enough? Is 14 days enough? And what are we learning about different approaches with head-to-head comparisons? And then in terms of additional cross-cutting themes, there was a discussion about impacts of the conflicting scientific evidence entering the public sphere and the impacts on public trust that results. And some of the panelists were referring to recently, as an example, the conflicting directions related to remdesivir that had come out in September. And secondly, the politicization of all issues related to COVID-19 and the communication processes and strategies that can support a more constructive public dialogue between groups. So that hopefully gives you a sense of what was discussed at the meeting and the types of priorities that are emerging. As I was mentioning, this is one of many initiatives that COVIDEND is undertaking. So here's a short list of some additional assets and resources that you can access through the website, and the link to the website is available on this slide. And finally, I just want to acknowledge that mostly this COVIDEND is done through the goodwill of the participants, and it has been, I think, from my own perspective, a great example of everybody putting effort into trying to achieve something collectively together. But there has been some funding that we've repurposed within Ontario that supports this, as well as some other funding buckets that we wanted to acknowledge there that have been supporting the activities. And I'll end with just leaving the link to the website up here in case you wanted to note it and have a look. The October Horizon Scanning summary and the briefing notes should be available by the end of the week. So that's it. I see that Steve has written in the chat box to please ask any questions or share comments, and I'll do my best to answer them. But I'd love to hear your reactions, whether you had any thoughts, have we missed out on something? Please do let me know.
Thanks, Heather, for a very interesting presentation. As Heather mentioned, please use the chat box to ask any questions or share comments, and we can get Heather to address them. There is one that's come through so far. First a comment and then a question. It just says, thank you for sharing your approach to horizon scanning and your recent findings. It's great to see this level of coordination and communication. And then the question is that they'd be interested to know how much time you spend on scanning each month and how you set boundaries and scope to manage timeliness versus rigor.
This is a great question. And I think I would say that the amount of time we spend on the scanning, we've become more efficient at it over time. So the first few months, it was, quite significant in terms of the amount of time each team member spent, probably somewhere between 5 and 7 hours for each team member. And then what I do is I take all the hits. They're doing the scanning for particular areas of the inventory, but there's overlap certainly, and issues aren't necessarily categorized according to our inventory. So part of the process that I then do is look at all the hits that the team has developed, rebucket, recategorize into do a bit of theming, I would say, and ensure that they're in the what I think is the most appropriate bucket of decisions. And so that process in itself takes some time. And then the other piece of work and the amount of time it takes is looking through that constantly updated list of priorities and then checking the inventory to see if there's any evidence best evidence syntheses that address the topic. So I would say we're probably down to around 5 hours-ish each doing the scan per month. So that's 4 people, 5 hours. I then probably spend another day and a half doing the briefing note and then participating in the panel, and then another day-ish, maybe less, on the summary. I hope that gives you a sense of it.
Thanks, Heather. We had a few more comments just thanking you for the presentation, but we don't have any additional questions at this point. We'll maybe just give it another minute in case others have questions, but thanks again for a great presentation and for, providing such a good overview of this process.
Thank you for joining us today, and I would love to come back in a few months and provide an update, and it would be really interesting to do a comparison of how priorities have shifted in let's say 3 months from now. I could put up some of those priorities that are key right now, and we could look at and compare how they change over time. It has been quite interesting to just hear this amazing group of people speak about what is critical in their country context currently. And Steve, I really appreciate the opportunity to share it with everybody.
Well, thanks, Heather. Just some more comments. Thank you for your presentation, and just to say how interesting it is to hear about your work, and that they admire how how you and the team are keeping on top of such a huge volume of information. So certainly quite an undertaking, but an important thing to do. So I don't think we have any other questions at this point, so I think we'll wrap up today's webinar, but we hope that everyone will join us for future COVIDEND webinars. The website is listed right there, and there is a page on there for presentations where you can see all the upcoming webinar information. We will be posting additional details about upcoming monthly webinars shortly. Thanks again, Heather. We really appreciate your time today, and we hope to see everybody soon.
Thank you, everyone. Have a good afternoon.